Ozempic, which was the Semaglutide-based original GLP-1. The difference between those two is that Tirzepatide is a dual agonist, and it works on two receptors. So it actually burns a little more fat than Ozempic. Ozempic, as we know, is great for weight loss, but maybe not necessarily for muscle retention. But Tirzepatide works a little better than that. Retatrutide is a triple agonist that's currently in phase 3 clinical trials. It's not yet FDA approved. Retatrutide works on 3 receptors. So it just, for simplicity's sake, not only reduces your appetite and burns your glucose, but it also frees up your fat to be burned as fuel. I've tried, 2 out of 3 of those GLP-1s. They work, and they reduce inflammation, reduce hunger and cravings for bad food. For me, they've been tremendous. I run Ironmans. I turn 55, it gets a little hard to do 140 miles, and certainly with a knee injury, right? So for me, peptides have been a godsend. Tirzepatide, especially, was reading a study last night that said it's being looked at for cognitive enhancements and Alzheimer's prevention. And all of them reduce inflammation. So they do give you additional benefits beyond just fat loss. The dangers, though, and these are well documented in the clinical studies, right? These are intensely researched drugs because of their FDA approval and their wide use, right? There's no joke and no lack of money behind the clinical studies. Because they do reduce your appetite drastically, if one doesn't eat enough protein and exercise, you can lose muscle and, you lose hair just like you would if you're not eating, right? It's as simple as that. It's not necessarily because of the drug. It's because of the peptide. It's because of the not eating part. And that's a serious danger. So everybody I talk to about the GLP-1 peptides, make sure they're doing resistance training and make sure they're eating, 1 gram of protein per, pound of body weight, the goal, ideal body weight.